Hey everyone, Dr. Tam here. Thank you so much for joining me on this amazing Father's Day here in 2024. And there is no better way for me to join you on Father's Day than to share with you what, as a father, we should be looking out for. As men, we should be looking out for ourselves and our health to provide a better life and health for our family. You've heard the saying, you can't help others until you help yourself first. And this is absolutely true. So I put together a webinar since I've recently turned 40 a couple of years ago. I've developed ways to really attack what men deal with in their 40 years of age and beyond. How do we look at women talk about aging gracefully. How do we as men age gracefully as well, but age with keeping our sexual health, our body mass, muscle mass, our alertness, right? Why are we living shorter lives than women in general? Today, I want to attack a lot of those things. I hope you get a lot of value out of this 30-minute webinar. And you have a phenomenal Father's Day, all right? So we have to identify the challenges and manage health challenges overall. So let's dive in. Number one, I want to introduce you to what we're doing and why we're doing this because, see, this topic for men over 40. We're going to dive into things about boosting testosterone, maintaining testosterone, preserving and increasing muscle mass, enhance blood circulation, addressing intimacy issues, erectile dysfunction, and overall wellness. Are you ready to dive in? All right, here's a health disclaimer. The information provided in this Men's Health at 40 and Up, Identifying Managing Common Health Challenges webinar is for education and informational purposes only. It is not intended for a substitute of professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding medical conditions. Consult a healthcare professional before making any health-related decisions based on the information presented on this webinar. Are we all clear about this? All right, let's go. So, a little bit about me. My name is Dr. Alex Tam, and I have a Bachelor of Science in Exercise Biology from UC Davis. I'm also the clinical director at Absolute Integrated Physical Medicine since 2009 here in Vacaville, California. We've treated over 10,000 patients, probably closer to 15,000 now. Now, our mission statement is that we help patients with chronic pain get their life back without harmful drugs or unnecessary surgery. I hope you're on the same page as well. So why is it that 40 and above is such an urgent topic, not only for me, but you should look into as well, whether it's for yourself, your father, your grandfather, your spouse, your brother. Share this webinar with them, all right? So number one, testosterone levels. By the age 40, testosterone levels have naturally declined at a rate of about 1% per year. Worst case, low testosterone can lead to decreased muscle mass, fatigue, depression, and increased body fat. Statistically, about 30%, 20 to 30% of men over 45 have hypogonadism. It's a condition characterized by low testosterone levels, right? Well, what's the second problem we deal with for men over 40? Muscle mass problems, sarcopenia. Muscle mass decrease an average of 3 to 5% every 10 years after the age of 30. Here we are talking about 40. It's after 30 is when this problem starts. Worst case, severe muscle loss can lead to frailty, reduced mobility because you can't move your joints as well anymore, and a higher risk of falls and fractures, right? It affects about 10% of people over the age of 60 and a lot more, 50% of people over 80. So how do you preserve that? I mean, chances are most people live above 60, okay? And you got to look at, well, what do you have to do above 60? Let's follow along. Poor circulation, that's the number 3 problem that us guys deal with. Sedentary lifestyle, poor cardiovascular health, heart health can lead to lower blood flow, right? And lower blood flow also increase the risk of heart disease, stroke, and peripheral artery disease, PAD. We don't need any more of that. Heart disease is the leading cause of death for men in the United States, within about 1 out of 4 deaths contributed to it. That's a statistic in 2021. So heart disease, what is it? What's the problem here? I mean, well, hold on one second here. Well, you've got blood pressure problems, cholesterol, unhealthy diet. They all contribute to heart disease. And it can be leading to heart attacks, heart failure, and even death. 50% of men who die suddenly of coronary artery and heart disease had no previous symptoms because, well, what's the first sign of a heart attack? Is a heart attack. And 1 out of 2 pass away right after the first heart attack. You want to stay away from this, all right? Intimacy and sexual health. This comes up so much in our office when men talk about problems. We ask them about this, and I'll say about 50% of the time it comes up in guys over 40. Psychological, sociological factors can impact intimacy as well. Erectile dysfunction can lead to significant relationship stress and decreased quality of life, right? Erectile dysfunction, it affects about 30 million men in the United States, with the prevalence increasing with age. It can cause from poor circulation, stress. Who would have thought stress causes erectile dysfunction? Yes, it can. And if underlying untreated, this could be a problem for cardiovascular disease. You might not even know of it yet. Stress and mental health. This is rampant here in the United States, especially after 2020, and it leads to a lot of mental health issues, anxiety, depression. We'll talk about that. Severe stress and severe mental issues can contribute to substance abuse and even suicide. Men are 4 times more likely than women to die by suicide. Okay, did you know that? We have to be aware of this. 4 times. We're not talking about 50%. We're talking about 400%. Okay, and this is, a lot of it is due to untreated mental health conditions. Sometimes you might not even know it yet, right? Poor sleep quality. Terrible sleep can affect hormone levels, especially that one problem called the testosterone, okay? Chronic sleep deprivation increases with risk of obesity. It increases your risk of obesity, diabetes, and cardiovascular disease. About 50 to 7 million adults have sleep disorders, and men with sleep apnea are twice as likely to have low testosterone. And prostate health, well, how many guys you know over the age of 40, well, especially 60, have prostate issues? Almost everyone has been diagnosed with prostate issues, because it starts with a benign hyperplasia, and then prostate cancer can increase with age. Worst case, advanced prostate cancer can be also life-threatening, because prostate cancer is the second most common cancer among men in the United States, within about 1 in 9 men diagnosed during their lifetime. Obesity, lastly, and unhealthy weight. Excess body weight contributes to various health issues, including diabetes, heart disease, and low testosterone. Worst case scenario, severe obesity can lead to significant reduce in lifespan quality of life. More than 70% of American men are overweight or obese, which increases the chance of other chronic diseases. So we need to attack that too, all right? So by understanding these problems and how you can fix them and seeing the future, you can now really work out your lifestyle so then you can prevent these problems in the future. That's why I created this webinar, and that's why we're doing this webinar. All right, so let's dive in. Here we go. Testosterone levels. How do you maintain testosterone levels? Okay, Muscle mass boosts testosterone levels. So you can maintain your muscle mass. Testosterone levels will either increase or maintain instead of loss. One of the best ways to maintain or increase muscle mass is by doing high intensity interval training with short bursts of maximum effort. Try it out for, say, 30 seconds to a minute, maybe two. Rest for a couple minutes and then go again. Now, diet is important. I know no one wants to hear the word diet, but you got to manage what you eat, right? Zinc-rich foods, oysters. You're talking about foods and beef that is 100% grass-fed, pumpkin seeds. You got to get enough vitamin D, right? Good fats from avocados, really pure olive oil, avocado oil. These are things that you can eat and provide into your body on top of omega-3s. That's going to help you boost testosterone levels. Okay, make sure you get your fruits and vegetables in, focusing on the way you exercise and also what you eat helps with testosterone levels. Right. How else do we maintain muscle mass? Well, you got to work on some weight-bearing activities, resistant training. Some people think that, I stretch. Well, stretching only elongates muscle. It doesn't help you build muscle, right? You got to work on that, and you got to have proper form, okay? You got to have proper biomechanics. Body weight exercises are great too. Maybe do some pull-ups, do some push-ups, do some light weights, and slowly increase the resistance. Ideally, you want to work out about 3 to 4 times a week in muscle resistance weight training exercises. Okay. Now, how do you improve blood flow? You got to stay active, can't be sedentary. Avoiding prolonged periods of sitting is a key. You've heard of sitting's the new smoking, right? So you got to regularly exercise. Aim for at least 30 minutes of moderate to intensity exercise on a daily. Maybe you got to go out for a brisk walk, okay? Integrate some squats here and there. Maybe every time you go take a sip of water, you do 5 to 10 squats. Integrate more movement to your daily routine. That's going to increase that blood flow. Blood flow happens when you move. Or you might ask, well, can I get a massage? Wouldn't that increase blood flow? Yes, but that's very passive. Passive blood flow really happens is the moment you're done with it, you're done. You don't get that burst of sustainable blood flow later on like exercise do, okay? So what else can we do to regulate our health? Well, you got to make sure you monitor your blood pressure and cholesterol levels on a regular basis. Make sure you're eating a healthy diet, right? Stick with the fruits and vegetables that are rich in color, that are dark and rich and bright. You got to focus on that. Look at that. Shop around the edge. Have you heard of this before? The edge of the grocery store, not the middle where all the junk food is, okay? You have to maintain good sodium intake, good potassium intake, and, maybe less fried stuff. Start with grilling and baking, okay, instead of the frying. So those are some key things. Okay, remember this thing that comes up a lot, sexual health, okay? You have to communicate. Gosh, I know a lot of guys and even my friends that don't communicate with their spouse like they should, right? Open communication is key. Listening to each other, making sure sociologically and psychologically that our body just needs to be able to communicate with each other, okay? Yes, the world is stressed enough when you're dealing it on your own, but if you're dealing it on your own and you've got your spouse or significant other stressing you out as well, sexual health isn't going to be good anyways. So make sure you take good care of your body, right? Maybe it's a pinched nerve. We've got patients that come in where their lower back hurts so much where, intimacy isn't even a thing anymore. So you got to fix that. Whether is it mental? Is it physical? Is it chemical? Fix it. Okay? So erectile dysfunction. Let's dive right into it. So a lot of common causes. People are like, what can cause my erectile dysfunction? In men 40 and above, look at this list. Obesity, okay, can cause erectile dysfunction. Hypertension, okay, hyperlipidemia, obesity, testosterone deficiency, cardiovascular disease, smoking. So what do I do about these problems? Try to get rid of it. Try to get rid of it one by one. Let's start attacking these, okay? Get some cardio health exercise, get moving. Like we've talked about earlier, a few slides back, you got to get moving. Do some workouts, 45 minutes, pretty intense, 3 times a week. Do some weight training. Gosh, you got to quit smoking, right? It was cool back in the 70s and 80s and the Camel and the Marlboro guys, but you got to quit smoking, because when you smoke, this erectile dysfunction, it's going to hit you like a ton of bricks, all right? Maybe look into natural testosterone therapy, all right? Something to look into, okay? So in order to eliminate or avoid erectile dysfunction, look at the next few things as well. Reducing your cholesterol, be physically active. We talked about that. Make sure you have a healthy weight. Getting a lot of good sleep, because what you don't realize is the less sleep you get, the lower your testosterone levels get too. You're like, what? I didn't know that. Yes, it's true. No smoking, stop the drinking, and certain foods you probably avoid, okay? So, how do you manage your stress? Okay, because not managing your stress, once again, this heart disease comes up quite a bit, because stress increases your risk of heart disease, diabetes, headaches, asthma, gastrointestinal problems, and, well, Alzheimer's. You like your memory? I do too. So you work out, exercise, do some yoga, do some meditation, okay? Maybe you need some adjustments. Maybe your body is just really stressed. Maybe you need to break down some of that scar tissue on your back with shockwave therapy. Whatever it is, you got to be able to manage that stress, okay? And eat healthy as well. This keeps coming up, but success leaves clues, all right? Get better sleep. I can't stress enough why sleep is so important. Okay, it's not just for your stress or testosterone levels, but it's good for your overall health. It's good for your overall body. See, quality of sleep, poor quality of sleep reduces testosterone levels in men, and it may cause erectile dysfunction, okay? You got to get about 8 hours. 7 to 8 hours is key. Some people need a little bit more. Some people need a little bit less. Have an active routine. If you're always sedentary, you're not burning off any calories, you're not moving, well, of course, by the time nighttime comes, you're not going to be that tired, because you barely did anything, all right? So make sure you get moving. Make sure you're in a quiet room, a dark place. Don't play with your phone before you go to sleep. Don't watch TV while you're in bed. Take that TV out of the bedroom, because what you do in the bedroom, your brain has a relationship with it. If you watch TV or play with your phone consistently in the bedroom, well, you're not going to be able to sleep until you're just super tired. How many of you are looking at your phone sideways, playing with it until you fall asleep, right? Don't do that, okay? Good nutrition, optimizing your melatonin levels, all right, by getting good sunlight. When you're out and about, you need the sun, because the sun allows your body to regulate melatonin levels, okay? Because if you don't get enough sun, your body doesn't know when you're awake or when it's bright outside, and you can't get melatonin. You can't produce melatonin at night very well, okay? Avoid sugars, coffee, caffeinated tea, caffeine. Avoid that, okay? All right, prostate health. This is a big one. So you got to monitor it, because your prostate starts to grow around the age of 25, but symptoms really become a problem at age about 40. And remember when I said earlier, guys above 60, there's a 50% chance of symptoms. And by the time you're 80, it goes up to 90%. So what are some of the symptoms? UTIs, urinary tract infections, bladder stones, bladder damage, blood in the urine, and enlarged prostate. Well, can it be prevented? Not really, but you can slow it down by getting checkups, making sure you're not taking as much caffeine, making sure that you are reducing your alcohol, okay? Because all these problems increase something called prostatitis, which is the inflammation of your prostate, okay? And when you get an inflammation of your prostate, now you can't go to the bathroom correctly, right? Certain medications will hugely affect it, like allergy medications. Some people take allergy medications or cold medications and wonder why, oh my God, I can't pee all of a sudden. That's because you have an enlarged prostate. Okay. Now, food. I can't even stress this enough about food. You are what you eat. There's no better way to say it. Everything that I've talked about before, from metabolism, muscle mass, testosterone, erectile dysfunction, Alzheimer's, prostate, all have to do with food as well. Food is part of it. So you might ask, well, Dr. Tam, what do I eat? I'll tell you what not to eat. Then we'll dive into what to eat. Avoid dairy, avoid gluten, avoid nightshade vegetables, and processed sugars. You avoid those 4 things, your life is going to be better. Then you add in a few things. Berries, all right, rich in phytonutrients, antioxidants. Make sure you're not eating foods that are very starchy, right? Leafy green vegetables. If you're going to eat meat, chicken's great. Make sure it's organic, free range, 100% grass-fed beef, 100% grass-fed. Anything is better than your regular grain-fed meats, all right? Seafood, make sure you're doing wild caught, all right? Wild caught is the key. Don't get the ones that are farmed, okay? Sustainably farmed. Wild caught is best. Good oils, avocado oil, olive oil. Go to a place that specifically makes olive oil. It's going to be different because the ones that store-bought, studies show, are mixed with some of the stuff in there that you probably don't want in your olive oil. Look that up, okay? So those are a few things. And practice some intermittent fasting, okay? What does that mean? That means you eat 2 meals a day, 1 meal a day. I'm not saying do that every day, but do that once in a while because it's going to help your body cleanse, all right? Gives your gut a break. You're going to increase mental clarity on top of that. Now, I really hope you learned a lot today because I shared a lot. I want all of you guys to have a phenomenal Father's Day. I want you to learn a lot. Share this webinar with others, okay? The recorded version is going to come out soon. Share it with others. Share it to your guy friends. They might not know a lot of these things, all right? Seek out help. If you need help, seek out professional help. Have a great day. Happy Father's Day. I'll see you on the next webinar.